Our last speaker today is Leanne Burns. Leanne is a registered dietitian and comes to us from New Orleans, where she's practiced most recently at LSU and at the Ochsner setting in Kenner. Leanne has practiced nutritional medical therapy for the last 20 years and has dedicated much of her efforts to cancer prevention and early detection. She has spent 15 years practicing as a nutritionist at the E.A. Conway LSU Health Science Center in Monroe, Louisiana, and she served as an instructor for LSU School of Medicine in Shreveport, where she cared for critically ill patients, including oncology patients. 18 years ago, she transferred to LSU New Orleans, where she is an instructor and clinical specialist in the Department of Nutrition. As a member of the Cancer Center, she's joined the statewide disease management team for cancer prevention and early detection. She teaches medical students, residents, and fellows in various areas of nutrition and participates in both research and patient care in oncology and cancer prevention. Leanne has specialized in clinical practice care of oncology patients, and this focuses on her last 15 years and spending much of the last 4 years working with carcinoid patients. So with that, we're certainly fortunate in having Leanne discuss with us the best diets for NET patients.
I'm going to make one correction. Actually, I went into practice with Lowell Anthony in 2002, so it's been a little bit more than 4. It's been, at the time this was done, probably 14 years, and now up to 15. So I'm glad to be here. Today we're going to spend some time trying to help you understand and maybe make some better choices of the foods and the diet that will help patients with neuroendocrine tumors. The best diet for neuroendocrine patients is a diet that contains foods and fluids with a nutritional value which the body can tolerate and absorb. And that's very important for neuroendocrine patients. If you're eating foods that your body cannot absorb, then it's not going to be able to give you all the nutrients that you need, the vitamins, the calories, and the protein. The USDA put out over the years many guidelines, and now the guidelines are based on the Choose My Plate. And you can find this information at choosemyplate.gov. But we follow the same basic meal plan when we're working on plans and nutrition for patients with neuroendocrine tumors. We just have to change the consistency sometimes and the amounts and things. So that's what we'll talk about today. Calorie needs for most individuals should have adequate calories. And the diet should have adequate calories, and the women really should have somewhere between 16 and 2,000 a day. That's a general amount. And men should have somewhere around 2,000 to 2,400 a day. But if I have a patient that's losing weight, to increase somebody's weight, we need to increase their calories by 500 a day. And if you want somebody to lose, we do it by decreasing 500 a day. There's a little known fact, but unless you've seen somebody like me that likes numbers, but 1 pound of body fat is equal to 3,500 calories. So if we give you 500 extra a day, in a week you should gain a pound. So this is how we kind of measure what we're doing, and the reverse for somebody that needs to lose weight. Protein is very important, and it's definitely something that we want to include and really increase in patients that are going through cancer treatment of all types, and neuroendocrine tumors are not an exception to this. We try to give you about an amount that you can tolerate, and usually do it throughout the day. We use a little equation for this, and it's somewhere between, we use kilogram of body weight when we're doing measurements. And how do you get that if you're sitting there wanting to figure out what it is just divide your weight by 2.2. It's going to give you how many kilograms you weigh. And then you can multiply this by somewhere between, if you're normal or your spouse of someone and you don't have increased needs, really you need somewhere between 0.8 and 1 gram of body weight, kilogram body weight. If you have cancer treatment, or if you have increased needs, as many of you in the room will have, We need to get that up, so we're going to multiply that times 1.2 to 2 grams per kilogram body weight. But remember, when you increase protein, you have to increase your fluids because we have to excrete these proteins byproducts. And if we don't get enough fluid, you can become dehydrated. So when we're looking at your diets, and everybody's different, just like the stripes on a zebra are all different a little bit, although they may be similar, all of you have a little bit different needs. And so when we're deciding what we want to do to make sure that diet is best for you, we also have to consider pre-existing medical conditions. So we'll look to see if you already have a condition of diabetes, or if our medicines may have increased your glucose some, if you have high blood pressure, kidney disease, fatty liver, which is very common in today's society, and especially when you live in New Orleans down there, where we just eat, drink, and be merry. So that's a big part of my practice. Obesity, surgeries, and surgeries can many times change to help you. We change or alter the structure of your GI tract, which will change the types and amounts of foods and some of the things that will feed you as well. And then some of the things that we worry about the most is if you've had GI surgeries, because we get what's called adhesions and narrowing that we don't cause, or if you already have a history of partial bowel obstructions. We also are going to base what we do to determine the foods and the symptom control on what your symptoms are. So let's start with normal. If you have no problems with digestion and you're not flushing, if you're a peanut, we may just let you go, just like we saw before, pretty close to what we want all Americans to eat, and a balanced diet. We don't alter that much. If you're diabetic, we will make sure that you have a good spread and certain types of carbohydrates that you can tolerate, so we can control your blood sugars. If you're someone that has high blood pressure, we may drop your sodium down so we don't increase your blood pressure problems. But if you do have digestive problems such as nausea, vomiting, diarrhea, steatorrhea, which is a fatty stool, or constipation, then we're going to address some changes in your diet. If you have carcinoid syndrome and or flushing, then we're going to have to be a little bit tighter or a little bit more restrictive on some of the amounts, or make sure that you're able to take medications that your doctors may have prescribed you to help with these as well. And the hyperglycemia, we're going to alter that and bring down things such as concentrated sweets and sugary foods so that we don't cause this hyperglycemia to become a bigger problem. And the same thing with fatty liver. Fatty liver is also affected by sugary foods and fats in the diet. So let's start with diarrhea. Usually I have to do this talk during lunch, so this really is, although it's close in the day, is good, because you don't have to listen to diarrhea and poop talk during lunch. So I'm glad today to be ending instead of the middle. But if you have short bowel syndrome, and short bowel syndrome is when the surgeons have had to go in and take out a substantial amount of your GI, of your small bowel, and resect it, put it back together, and it'll change how the absorption is done. Right after surgery, before your body adapts, it'll be a little harder, and we're real careful with what we feed you and amount of sugary foods, and we'll change things. We actually, if you have short bowel syndrome, we actually put your fluids away from the solid foods by 30 to 45 minutes before or after. This will help decrease your emptying time. Inflammatory bowel disease can also cause diarrhea. And some patients that have carcinoid already have this disease. And some patients with carcinoid may already have celiac sprue. So these are things outside of what would be normal for someone with carcinoid or any neuroendocrine, but it happens in the general population. Diarrhea can occur from pancreatic insufficiency. And pancreatic insufficiency is often a symptom or side effect of not only the surgeries that we do, but sometimes the medications that we're having to use to treat you. And this is very common, especially with the somatostatic analogs. Gallbladder removal can change your diet quite a bit. Dr. Boudreaux, Phil Boudreaux, some of y'all may know him, took mine out years ago and changed my life. So that's why I'm so good at what I do, because I live with most of the symptoms that some of y'all will. I have a little bit of a bile leak, so I have to be very careful. And that will change as well. Bacteria overgrowth, some of you may have heard this. People may put you on a probiotic to keep the good bacteria there and not let the bad bacteria overgrow the GI tract. The bile salt colitis is also a bile-related diarrhea, and it can really change your motility. You'll have more frequent urgent stools. And then again, the drug-induced somatostatin analogs can cause the diarrhea as well. So let's remember, diet should be healthy, and that's for all individuals. All Americans should eat a balanced diet that's low in fat and sugar. So when I change your diet, it should be, sometimes it's everybody in the house should be eating the same thing. I often get asked, well, how am I going to eat this and feed my husband different or something? But very often the same foods are really good for everybody in the household. And we can just change the little bit of the cooking preparation to make it a little bit better for you. So let's talk a little now let's get to specifics on some of the foods and food sources. Proteins are found in lean meats, and we get really negative a lot of times about red meats, and so I put up this for you. The American Institute of Cancer Research came out, and they are a great place and a great resource for really good information in diet, and they have come up with some recommendations. And they say as long as we keep the red meats down to 18 ounces per week, then we should not increase our cancer risk of the bowel, and that's colon as well. 18 is probably a little higher than most of us are getting, although some of us in today's time eat a lot of burgers, and those things can really create a higher amount pretty fast. But red meats include pork. It's not really the other white meat. It's really a red meat, and as well as lamb. So these are also included with beef. Poultry, eggs, and egg substitutes are very important proteins. Fresh fish are wonderful sources of protein, and usually probably one of the easiest for you to digest. But I always want people to realize that the fatty fish that we use that are wonderful for our cardiac risk to reduce some of our incidents, they're fatty fish, and so that fatty fish can also cause you to have the problems that we have with diarrhea, and because they're a little higher. I definitely want you to include it in your diet, but just remember that we don't want to excessively eat this in higher amounts, or you may have to take the medicine that your doctor has prescribed you, such as the pancreatic enzymes, to help you digest these foods as well. Wild game is sometimes very common in some areas where you may be eating venison and birds such as quail, and those things are very good for you and very lean, as a matter of fact. Quinoa is one of the only plant sources of a total protein that we have. It's usually tolerated very well in our patient population and can be included in your diet as well. We use a lot of this in the population of vegetarians that come to see me. Lentils, soy, nut butters can also be used effectively as long as you use the medication to digest them. But nuts, and even the peanut butter nuts that have like the chunky, can irritate the GI tract. So we want to try to keep those down to a minimal and use the smooth nut butters. It can be cashew butters, it can be peanut butters. But there are some things that make it a little harder to digest, and those are the dried beans. When we say dried beans, we're really talking about red beans, black beans, and pintos as being the hardest to digest. Some of the beans really do pretty well. The garbanzo beans, many people eat hummus and things like that. Those tend to do pretty well. The peas, the black-eyed peas, which are sometimes put into the dried bean group, do pretty well. And the limas and white beans tend to do okay. Fresh seafood is a wonderful source, and they do very well. And if you're from Louisiana, alligator is also very acceptable lean meat. So if you see those crossing your road, you're welcome to kill them and eat those too. Grains are very important. They tend to be where we get our complex carbohydrates that we use in a normal diet. In a normal diet, we usually hear people saying we want you to use all these whole grains, and you'll see people getting those 9-grain breads and things in this order. And those things are fine if you have a normal GI tract. And we recommend you get about 35 grams of fiber daily. But if you have trouble with diarrhea, malabsorption, we really try to change the types of fiber you use, and we use what's called soluble fibers. The soluble fibers are the insides of the fruits and vegetables, so without the peel. The peel is insoluble. Soluble fibers are digest, they go through the system slower, and they actually can help you absorb some water into the stool. Where insoluble, which is the peels and the seeds of your fruits and vegetables, and stalky vegetables such as celery. I always say I hate to see Thanksgiving coming because people put all this celery in their dressings, and many times we'll have trouble with obstructions and partial obstructions about that time, and I'm not too sure I'm not right. So we try to get you to take the peels, the seeds off, and try to cook down some vegetables a little bit more than using just raw. Non-gassy foods are foods that we try to get you to use when you're coming out of surgeries, and people that many times maintain some gas problems even as they go along in the management of their disease. And there was a diet that was put out several years ago, and it's called the FODMAP, which is an abbreviation for many words there, but it's pretty common. You can find it on the internet readily, and many of the dietitians that practice are using these. And what it is a short term, we kind of eliminate the foods that cause the most gas, and we take you off of them for about 30 days, and your body can many times reset, and you can slowly add these back and see how you do and and see if the tolerance can come back. And it sure helps us as dietitians trying to figure out what you can tolerate and what you cannot tolerate. But very helpful in dropping the gas in these foods. Many times we have to put patients on low fiber diets, either because they tend to have these multitude of partial obstructions and are readmitted to the hospitals. And with these patients, or if you're one, we try to keep your fiber down less than 13 grams a day. We talked about quinoa already. Quinoa, some of the other, because it's also a carbohydrate as well as a protein. Potatoes get a pretty bad rap, but they're really very beneficial and probably one of the best sources of carbohydrates and energy in a patient that's having a lot of diarrhea. So I don't want you to eat the skin on this, but the inside pulp is very easy to digest, and it can really make a difference in whether you can tolerate foods for a little while. We're, of course, from the South, so white rice and rice are used often, but it also, again, is something that can really help with the diarrhea. As a matter of fact, if you go back, way back in the day, we used to use a lot of rice milk to hydrate after surgeries, and patients and even children that were having a lot of diarrhea, we use this. Pastas are very good. They can usually tolerate it very well, and they can be worked into the system very well. Couscous is another carbohydrate grain that is tolerated very well for most all the people that are with carcinoid and neuroendocrine tumors as well, and give you a little bit of variety to these grains that you're consuming. If you're having problems with diarrhea, we want you to choose breads that probably have around less than 3 grams of fiber. It just helps you digest them a little faster and a little easier. You don't have to work so hard to digest all the grains. And if you do these high grain breads, the ones you can see, the nuts and the seeds in, many times those things will increase the motility. They aggravate the GI tract a little bit and increase your stools. So we want to keep this down. Cereals, we try to use the ones that are whole grain, but the ones that tend to do better are the ones that are oatmeal based, Cheerios, something like that, Rice Krispies, things that are broken down a little bit, and oats are tolerated a little bit better than wheat in many people. Wheat can be a little bit too gas forming as a whole. Some of the other things in the grain group that we like to include are your cereals like oatmeal, grits, of course, would be on my list, and then cream of wheat, which are also easy to fit into your breakfast meals or your supper meals where you might want something a little lighter, but that will stay with you longer. Fruits are very important. We try to use as much fresh fruits as we can, but we know that some of these can contribute to syndrome. So if we try to keep you off of overripe fruits that may increase this, those are associated many times with bananas. They, I guess, have probably the worst, but actually avocados can fall in this group. It's what causes the softening as they ripen, something and you can feel it, it'll soften. When foods age, they break down to a protein, which is really a precursor to the tryptophan that causes syndrome. Okay, so we keep you off, and that's why you'll hear as we go through the different groups, the aged or fermented foods tend to be the ones that are going to be associated with the increase in the tryptophan. Fruit juice needs to be diluted. Concentrated sweets and colas, anything that's sugar-based, can actually increase your diarrhea. So we want to at least dilute it or avoid it. Usually if you do it by half water, you'll get a pretty good dilution. What we're trying to do is get it less than 12 grams of sugar, and so that usually will do it. Strawberries, melons tend to do pretty well. Nectarines and mangoes sometimes really can be soft and tolerated pretty well as also without being too high in fiber. And when the melons here, really the cantaloupe and honeydew do a little bit better. We'll talk a few minutes. Watermelon has a lot of fiber in it, and those tend not to do quite as well as the pineapples. And it's not because of the flushing, it's because of the fiber content and the increased stool output, and as well as sometimes obstructions. So vegetables are so important. Dietitians are always trying to get vegetables in you, right? But it's hard to select these, and I am so proud of how they've worked with it in these meals over the last 2 days that I've been here, because they tried to give you some options that are very well tolerated, but cooked in a form that you could eat them. So I hope you found this beneficial as well. While I'm saying that, some of the foods that we've used were from some of the recipes that we are out there that can help you know what you're eating, and so you got a chance to taste some of these this week. Frozen and canned foods are the best for you. We want to try to keep salt out of your diet, especially if you're hypertensive or if you're having trouble with swelling. Sometimes you'll get fluid in different stages of disease that make your belly collect fluid, and the salt will make that worse. So we try to stay away from some of the canned. We really want to use fresh, frozen, and then if you're going to use canned, you want to use canned, no salt added. Cook to a soft consistency if you're having trouble with poor digestion. I get teased a little bit about this, but this really makes a good bit of difference. And if you're having a lot of problems and you've lost weight and you're having trouble going back, there's many times that I'll almost go to baby food consistency at first to get you built back up, because it does not work the body quite so hard to get you to absorb it. You don't have to chew as much. Many times your acid in your stomach's not quite as, you may be on protonics or something that's reduced the acid, and this will help you absorb a little bit better. But I do think you ought to make it soft, especially if you're having trouble with the digestion. If you're having a normal diet and you want to eat the raw, that's fine, but be careful. And lettuce is another option that tends to be challenging. What I've found is that my salad lovers that don't want to give up salads tend to do better if they just use iceberg and shred it, and iceberg tends to be a little bit better tolerated. But sometimes, and you already may experience this, many of you know this all too well, salads do not do well. They tend to go straight through you, so be very careful. Another option on salads, or problem with salads, is many times you load it down with salad dressing, and the fat in the salad dressing will not digest very well either, so be careful with that. If you're having trouble with gas, or diarrhea because gas pushes stool a little harder through the system, a little faster. You want to avoid what we call cruciferous vegetables because they're gas forming. Although they're very valuable in the system for normal GI tracts, they cause gas in everybody, not just patients with neuroendocrine tumors. So this is going to be your cabbages, your cauliflower, broccoli, Brussels sprouts, and onions. And this can include onion powders, which are in many of the pre-mixed seasonings out there. So we have to be careful of these and change things around a little bit. But those are the ones that we really tend to be a little bit cautious of in the vegetable area. So dairy is very valuable, but it needs to be a little bit lower in fat than the normal. Low fat milk, 1%. Soy milk, no sugar added, tends to be tolerated for those that are not drinking milk or dairy intolerant, lactose intolerant as well. Rice milk and almond milk with no sugar added. Those things can give you some options that'll help you do dry cereal, something to take as well, or even just drink. Plain low-fat yogurt is one of my favorite things to cook with. When you're trying to make decisions on what to cook, sometimes you want sauces or you need something to put with your chicken. And a good example of that was with our pasta today, where you had the pasta and chicken. You really need something to put a cream or make it creamier. Well, we can't use whole creams very well because we just talked about the fat in that is not tolerated well. So if you use low-fat yogurt, it is very creamy and it can be worked into almost everybody's diet. And it's got a lot of health benefits as well. So remember to put that on your list. That's something to really, really work with. Greek yogurt tends to have a little bit more protein and it's a little creamier and is well accepted. Also, ricotta cheese and cottage cheese are very good sources of dairy that we can use with meal plans. Some of you may like to stuff, it gives you good protein. You can stuff pasta noodles with it and use it in many areas of cooking that can give you some good flavor, good benefits and different textures, give you everything at one time. And that's what we try to do, is give you as many nutrients at one time as we can. Low-fat, sugar-free ice cream tends to be tolerated pretty well. Many of my patients want to eat ice cream at night or eat before they go to bed, and I say, if you're at home and you know where you're going to go to the bathroom, and that's something you want, then that's fine, as long as you're not losing weight. If you're losing a lot of weight, I really don't even want you to do that because I need you to absorb everything, and we're losing diarrhea. Sometimes we lose some of the vital nutrients in those, including vitamin D. So we try to get in even this type of dairy in ways that you can absorb it better. So fats. Fats are usually tolerated in about a teaspoon at a time, or if you're using a light margarine or light butter, it's whipped in ice and air. That's how it becomes light. So you get a little bit bigger serving of that. Usually can get a tablespoon. We do feel like, and this is across the board, yes, I'm from Louisiana, but I really believe unless you're in my home state, you need to avoid deep fried foods. So, but no, these things are really hard to digest, and many people, not just people with neuroendocrines, have a hard time tolerating the fats in these deep fried foods. They also become a real issue with weight and weight control as well. Avocados are fats. Olives are also fats. They're healthy. They can be worked into meal plans, but a serving size of an avocado is a slice of my finger. It's not a half a cup of guacamole, and that's where we tend to get into trouble. So we got to watch these things as well. Avocados, as I said before, they can cause the flushing from being overripe, so we also have to be very cautious with those if you're having flushing still. We also want to choose the light or low-fat products when you select salad dressings. Many of the products that have fat in them will have really too much for y'all to tolerate, and myself as well. Even with just the gallbladder being removed, I do not tolerate fats very well at all, and I have to take a medication, and many of you may be prescribed medications to help you with digesting these foods, and I do advise you to do what your physicians say and take it, and we'll talk a little bit more about it at the end. There are butter flavoring on the market, powders, and those things can give you some options, and they're low fat, and they really can give you some flavor when we're looking for something new to do. Healthy oils, such as the olive oil, canola oils, are very healthy for you, but they can still cause diarrhea. And sometimes it's a little confusing because you say, well, they said it was healthy for my heart, but if you don't digest it, it's not healthy for you. So if you eat these things and they go straight through you, or you have floaty stools, then these things are not being digested. Beverages, we try to get you to drink 6 to 8 ounces glasses per day. Very few of my patients can do this straight up, so we really break it down to about 4 ounces at a time, and just sipping throughout the day does better for patients that are having problems with diarrhea. Also, we talked a few minutes ago about the dumping syndrome or Whipple's. If you've had these procedures, it's very important that you separate your liquids from your solids by 30-45 minutes prior to the meals or after the meals, and it will help you digest it. Another note on that is that if you have had a Whipple, you need to use, and diarrhea, you really need to use sugar-free drinks. Water or flavored water are usually tolerated very well. We want to make sure the caffeine is kept out of the drinks because they do stimulate the GI tract and will increase your stool output, as well as the sugar we just discussed. But if you dilute the juices or sports drinks, those can be used, and it can be a great option. Decaffeinated coffee can be tolerated, and some of the sugar-free choices out there can also be useful if you're having diarrhea. I tend to use the ones that are more natural now. I think those are pretty much tolerated and accepted by most of us in the medical field, something like stevia, which is really an herbal base. Carbonated drinks also increase gas, and they can increase diarrhea as well. Seasoning. I love to grow herbs, so we tend to use the seasonings that are around our house, and I encourage you all to do this. Not only growing them is fun, but do explore them. Natural herbs can be really beneficial, add a lot of flavor. They don't add sodium, they're not hard on the system, and they can really give you some great ideas on how to change your diet and the taste and flavors of food, so it's just not always bland. You don't get tired of it as quick. So use these things: basil, oregano, rosemary. There's a lot of benefits to these for many reasons. Dill, chives. We said that the onion causes gas, but chives are a great alternative, or green onions. That part does not cause the gas to form as much, so we use these as a change in your diet and your recipes. Nutmeg, cinnamon can give you great flavors, and there are also health benefits to these as well. Ground brown black pepper can be tolerated, and especially in small amounts. Curry, if you're a curry eater and you're used to curry, if you've never eaten curry, be a little bit careful on your first time, just because it's a little bit different and people tend to do a little bit different, but it's definitely a good alternative. If you have no gas problems, then you probably can use some of the onions and the garlic as well, and their powders in their seasonings. But we want to make sure, if you're having syndrome, is that you avoid any hot spices. If it makes your tongue burn, if it's hot to taste, then these things can cause you to have a flushing. So let's talk about preparation, because we talked to it earlier that sometimes it's not the food you eat, it's how you prepare it. So if you're baking, some of these tend to be a great alternative to frying, broiling, boiling. Braising is just is simmering in a small amount of fluid, and this can tenderize many of your meats and give you some really robust flavors and help you to tolerate those foods as well. And grilling's very good, and in the South we tend to probably do more grilling than we should, but we want to make sure that you put it not directly over the flames so that it chars the meat. This has been associated with a form of colon cancer. It produces an amino acids that can do that. Be careful with that. Other than that, they can still be very beneficial. Avoid raw foods if you're having a problem with your immune system or if you're having diarrhea. These things can affect it. The reason being is you tend to get foodborne illnesses faster, and food safety is a very important thing when we talk about foods. Not only do we want to make sure they're cooked all the way done, we want to make sure when you're using chopping boards that you separate the boards and you clean them between each type of food. If you use meats on the board, you clean it good before you start chopping your vegetables. and you clean them good before you chop anything else. And you do not put cooked foods in the same place you've had raw foods. This is very important. Sometimes we see diarrhea from foodborne illness and we don't know exactly the cause, and it gets confusing. So make sure that we use very good cooking and storage techniques as well. Do not leave food out for I really don't like for my patients with neuroendocrine tumors to leave it out at all. As soon as it's cool, I like for you to package it in serving sizes and put it in your freezer. That way, when you're having a bad day, you don't feel like cooking, you can take down that food you've already prepared, put it into microwave or into hot water in these bags, and you can prepare it again very quickly. But you don't have the problem with aging process, because leftover foods can also do the same thing we were talking a little bit about with the ripened vegetables and fruit. It's an aging process. Oh, I didn't go to it in dairy. In dairy, we worry about cheeses. Aged cheeses do the same thing. It's the aging process that causes this. So be very careful with cheeses. If you count, and I use it in recipes all the time, but low-fat American cheese can count as a dairy, although I'm not too sure we really ought to call it a cheese. It's more of a processed food. But it is a way to use and give you some creativity and get a cheese back into your food system or your foods. So we want to use meal plans. When we talk about meal plans, it's when you see a dietitian, that's really our job, is to kind of give you how much you need at different times in the selections. And so that's what I do, basically. Well, here we are. I knew we got to it. So these are the things that we're really careful with when we put together your meal plans if you're having symptoms. So we want to avoid aged fermented foods if you're having carcinoid syndrome. Those are the cheeses, that's miso, that's soy or aged smoked foods, smoked meats, pickled foods, shrimp paste. Shrimp paste is in many of the Asian dishes. Many of the foods and recipes we cook in South Louisiana may also include these, and processed meats. These foods can really cause syndrome. We want to avoid meats and fruits and vegetables, again, associated with the syndrome, and these are the ones we talked about that soften as they age or are already prepared, cured, smoked. That's because of the aging as well. I want you to avoid MSG, and really, I'm not too sure, and I don't think we've ever been able to prove if MSG actually causes carcinoid syndrome. But what we know about MSG is it can make everybody flush. And then if you're eating MSG, which is in almost every fast food out there, actually I teach, and so I sent my students out to find the sources and the high sources of MSG. Surprisingly enough, it was in the green beans at Kentucky Fried Chicken. So it's not always in the Chinese food. It's in almost all of your fast foods. And the reason for that is it is a neurotransmitter. It makes you think foods taste better, and it makes you want them. So people, when the restaurants want you to come back, MSG is one of them. It's a flavor enhancer. So we have to be very careful with those in our food system. And also we need to avoid alcohol beverages if you're having syndrome as well, and you probably already heard that with the 3 E's, we know that alcohol is a big contributor of this. So let's talk about our meal plan. The first thing I want you to do is to make a grocery list, and your list needs to be appropriate for your symptoms. You do not have probably if you look at the people at the table with you, you won't all have the same symptoms, right? So everybody's grocery list may be a little bit different. But when you know that you're tolerating foods, put that on your list. And you know that's something. If you've eaten chicken and you know chicken works, put that on your list. So that when you go to the grocery store, you have these things. So put foods you know, make a 3-day menu so that you know what you're going to eat for the next 3 days. It's very challenging when you're sick to make decisions. And if you wait till tomorrow to decide whenever you wait to decide what you're going to eat on the day you're going to eat it, then you may make mistakes because you're going to grab what smells better. And I can tell you that fried chicken always smells better than baked chicken, all the time. So you got to be careful with this. So think ahead. If you know today what you're going to eat tomorrow, that takes a lot of the stress out of it, out of choices. And we know that stress alone can increase your symptoms. So make it a little bit easier on yourself. Many times people eat about the same foods rotating within a 3 to 5 day period. But go ahead and get your shopping done ahead. Make these lists so that these are things that if you don't feel good, you can hand to a family member or somebody else that's on your support group, support team, and they can go do this for you. Store foods after preparation. We talked about this so that you have them for those future meals. This also gives you great options and great ideas of what you're going to have. And it's usually foods you already like. You cooked it, so you already have it ready. And if you do have a bad day, somebody can help you come in and get these in for you. Avoid leftovers over 48 hours. If it's been in the refrigerator, I don't even like 24, but never over 48, and that's a food safety. So I talked about many of the proteins, but we're going to talk about stocking your shelves or what you should keep in the house. So we know fresh is always best, and we have frozen foods, but sometimes you need something in your shelves, and you need staple goods. So some of the things we'll put in there may be the canned meats, packed tuna, powdered milk, nut butters. We talked about these already, and quinoa. These are things that we can cook and you can prepare, and they can be there on the days you don't feel like going to the grocery store or you don't have the other ones present, because we don't want you to run out of food. Then we tend to get into foods that somebody else may bring you and you will not tolerate as well. Carbohydrates, my picture's gone on this one, but some of the things I didn't talk about that are also good sources are instant potatoes that you can keep in your cupboard and in your pantry, and these can be used. They're also great thickenings when you need something to thicken and we can't use some of the other things that we've used in the past as thickeners. Instant potato is really good, and it works. We can really add texture to foods with it. Grains and soluble fibers or insoluble fibers that we try to keep around, more of the soluble if you're having diarrhea, and that's really the rice, white rice or brown rice, both of them. Neither one of them have a lot of fiber, and if you're not eating more than a cup, either one of them really is a good choice. Their pastas we would count in there as well. Some people can tolerate the white beans, the garbanzo beans. These are also good choices that you can keep on hand. And cereals, whether it be a hot cereal like oatmeal or cream of wheat, or some of your over-the-counter, your box cereals can also. But don't do the ones with sugar in it. Try to keep your grams of sugar down to around 5. Fats, make sure you have cooking oils that you can tolerate. Some of you may be on MCT oil or medically that a physician may prescribe. These are tolerated by most patients. They don't have the same absorption as the other fats, and so they're very beneficial for us increasing weight in patients that are losing weight. Coconut oil, not oil, but oil, is also one of those things that have come back on the market. It used to be hard to find them, but now they're really popular. They became very popular within the last 2 to 3 years, and they're available, and those can be used and tolerated a little bit better than your butter and your avocados and things like that. Sesame oils, all of those. So here's your list for the grocery store. Do not go hungry. And that doesn't matter if you are a patient or a spouse or anybody else. Do not go to the grocery store hungry, because you make bad decisions when you do that. Take a list. Know what you're in there to buy. If you start going through the aisles and you see everything that they put out that they want you to get, then you're going to make bad choices. Replace your pantry staples. Make sure that the things that you decide that your body can absorb well are always in your pantry, so that you're not going to be without, and that would keep you from making really bad mistakes. So this is the rule of thumb. If you can't digest it and you can't resist it, don't buy it. Don't bring it in the house. But my grandchildren need cookies, so I'm going to keep those cookies. Well, the grandkids aren't usually the ones eating the cookies. So be very careful. Don't make excuses. Don't bring things in that you know. And for my diabetics in here and my peanuts, this is really important for you, because you're already challenged with some of the carbohydrates out there and the sugary foods. So if somebody of your spouse tends to bring these into the house, then you're going to get into it. I raised an insulin-dependent diabetic child, and if he couldn't eat it, it didn't come in the house. And so his sister and I lived fine We were never hurt by the fact that we did not have sugar in the house. So, it really doesn't, you have to make adjustments, and this is one of them that really can help everybody in the household. Plan ahead. Know what your meals are going to be. See a dietitian if you need to that's trained in this, or trained in if you're a PNET, a good diabetic specialist, educator that can help you set your meal plans together and then go through those food selections, and so that you know ahead of time what you're going to do. And I hope I'll leave enough time for questions so we can talk and see, give you a little bit more information on what you may personally need. But I do have my meal plan, and my favorite meal plan is 6 small frequent feedings, so that you always have a little bit throughout the day of protein and carbohydrates with a little bit of fat, so that you have a good energy load. Problems that we have with flushing, a lot of times it's the amount that you eat. It's not, if you ate a little of it, it wouldn't do anything to you. But if a half a cup could do it, and you'd be fine. But when you get to a cup and a half, you're getting problems. So many times it's just that small frequent feedings is very important. And we want to get it from the variety that we have here, and we want to do a rainbow in colors. And so I always get hit, well, you ask us to do everything white. So I have great examples of some of the things that you've seen on the tables this week, which are great choices of vegetables and that you can tolerate well. And one of them was the beets. Did you eat the beet salad? Anybody? It was a wonderful choice, right? And it's beautiful, right? And it looked good, and you wanted it because it looked good. So remember these things. You may not have done well with the green salad, but that beet salad gave you great flavor, great so there are great options. Winter squash, acorn squash, spaghetti squash. These things are great alternatives to even sweet potatoes, which may be more gassy. They've got a tremendous amount of nutrients in them. And there are recipes. And I did ask, I have had the privilege, and I guess I should have started the talk with this. I've had the privilege, as my disclaimer, as pharmaceutical companies, Novartis, Lexicon, Ipsen, have given me the opportunity to develop patient education for many years. And I asked them to please leave this information for you as you walk out today. Novartis has a table on this side. Over the years, I've probably written 30 to 40 recipes for them. They've put the last ones in a booklet. I think the last 10 are in a book out, in a little small pamphlet. The others are on little cards. If you're on the Lexicon drug, then there's a book that I wrote for them on how to choose the foods you love. You may have seen it. And these things will give you other ideas so that you can learn to do these things in different ways. So take those things, please, when you leave, because I asked them to leave them and they had to ship them back. They're going to be really mad at me. So grab them for your support groups or other members of your area that may also benefit from them. Medications are very important in treatment, and digestion is no exception. Your doctors can order you medicines that can help you absorb the foods much better. These can be pancreatic enzymes, they can be bile binders, cholestyramine being the main one of those, that will bind the bile and help you with digestion, and low motil or Imodium as well. So be sure that you take them with you when you travel, take them with you when you go to the restaurant. Make sure you have these things with you. When you dine out, check the menu before you go. Contact the restaurant if you need to see what they can serve so you're not embarrassed when you get there or not sure how to order. Take your medicine with you. Understand what the words mean. Some of the things you may see is cream sauce. Well, they're high in fat, so try to avoid these. Pureed vegetables, many times you'll get something and it'll say, I had a wonderful meal the other day and it had scallops on pureed corn something. And so it was great and it gave great flavor. I've seen the same thing done with beets where you can put the meat over the pureed beets and it gives you a wonderful sauce to add to the meats. And those work very well. Steamed and braised foods tend to do very well. But remember, if you see tartare, that's a raw product, and we really don't want you to have raw products. And as well, sushi can fall in that line as well. So the appetizers can be done well. Your salads, you may absorb them, but you may need a different type like we did with the beets. Appetizers, really broth-based soups do very well. Things that aren't fried may do very well. Be careful with those. Entrees, try to choose ones that are very lean. A lean cut of beef is something like a loin, tenderloin. Or if it says round, round roast, those tend to be very lean. Chicken tends to be lean without the skin. Desserts, try to avoid chocolate. I saw the snack table, so as I say that, it is what it is. Try to avoid chocolate and try to avoid a lot of cream in these foods, and be careful with things as regular cold drinks and coffee as well. So in conclusion, like many of us have said today, zebras have many stripes. Patients that are living with neuroendocrine tumors have very variety of symptoms. You're all different. We want to take care of all of your needs. So find some of us that do this. Find a registered dietitian that is trained in this, or have them contact someone like myself that does this, and we'll be glad to help them. If you see a dietitian and they're not sure what to do this, because I had the privilege of working with wonderful experts, and I was able to see 300 patients with these types of tumors every year since 2002. So I've got experience because I listened to y'all. I watched what you were doing. I learned from you. That's how I became good at what I do. But other dietitians may not see but one of you in 10 years. So I can't expect them to know what to do. But have them contact us. There's a few of us around, and I'm more than happy to help any of you and any of them. I do have webinars that are available on the Association for Dietitians that they can get to as well, that I did this year. I will continue to support you. He didn't tell you, I retired this year, and I'm on my own now. So I'm not quite as easy to find, but I want to continue to provide patient education to you, and I've been given a great privilege by Mary Ann and this association to be able to continue to do this, to continue to help you, and to enjoy seeing everybody thrive. So with that, I'm going to conclude, and I want to thank you for having me.